What we're going to look at today is basic life support, and we will be going along the guidelines of the Resource Council UK, and I will take you through each stage of the processes when we are assessing someone in a critical condition. So if I come into an area now, it could be someone's home, it could be outside, it could be at work, but if I come into an area and I see someone on the floor or stooped over on a chair, okay, it's not right, okay? So the first thing I may do is shout out their name, if I know their name, or oi. So if I'm loud enough, if they're conscious, they'll tend to turn around to wherever that noise is coming from. Bob, you alright? Jason, I'm just embarrassed. I slipped on some bit of flooring, my legs went one way, my head went the other way, and down I come crashing down. Are you injured? Are you hurt? No, just my pride. Do I have to take it further than that? Do I have to waste time and call the emergency services? No, they're telling me that they're okay, but I will continue with that communication. However, if I come into an area and I don't like the response that I'm getting, or I don't like how they look, okay, I will raise the alarm. I will dial 999, 911, whatever emergency number it is, wherever you are. Okay. Now, before I approach, I need to make sure that the area is safe. Okay. There's no hazards there that's going to cause me any injuries, such as broken glass, broken furniture. Maybe they were doing a little bit of DIY and they've been electrocuted and there's wires everywhere. Before I touch that person, make sure that the power has been isolated, therefore it is safe for you to touch the casualty. Now that I've checked the area and it is now safe for me to approach, I will try and get a response from them. Now, we're going to be looking at 5 levels of responses. Are they alert? Are they confused? Are they following my verbal commands? Do I have to give some physical discomfort to get a response? And are they conscious or unconscious? Okay. So Bob, can you hear me? Can you open your eyes for me? Can you squeeze my hand? No, I've gone to both sides of the head because they may have a hearing impairment. Maybe they haven't got their hearing aid in or their cochlear implant connected. Maybe they've received a head injury that's causing that hearing loss. So it's important to go to both sides of the head. Now, as we go towards that state of unconsciousness, we start to lose a certain amount of muscle control. So Bob's brain might be telling him to open his eyes, but if he doesn't fully open his eyes, what you might get is a little fluttering of the eyes, movement of the eyebrows as they try to open up their eyes. Now, if they squeeze my hand, regardless of whether it's a weak squeeze or a firm squeeze, that is telling me that they are responding to my verbal commands. Now, if they're not responding to my verbal commands, what I may have to do then is apply physical discomfort so that they feel pain and react to that pain. So there are a couple of methods that we can do. We can do the trapeze squeeze, so round between the shoulders and the neck. I will give it a good squeeze. I will also give a clavicle tap or a collarbone tap firmly, enough for them to feel it. The kind of responses I'm looking for is a wincing of the face, shrugging of the shoulders, flinching of the arms, something that tells me that they are responding to that physical discomfort. If they're not responding to that physical discomfort, they are unresponsive. Medically, they will be unconscious. If they are unconscious, at this point in time, if I haven't called for emergency services, this is the best time to do it. I am now going to look at our A, B's and C's, so our airways, breathing and circulation. Okay, so things that can block the airways could be such things as food or some other foreign object that they have choked on. So before I tilt the head, I will open up the mouth to check to see if there is any blockages in there. If there is, I will turn the head to the side and hopefully it will fall out, and then I can reassess the mouth for any further objects. Okay. But if I'm looking in there and I don't see any foreign objects, but Bob's tongue may block the airways. Okay, so from here, to take the tongue away from the back of the throat, lift the chin, tilt the head back, and that takes the tongue off the back of the throat. You may hear a gasp of air coming down there as the airway is open. Now, if I suspect trauma to the head, neck and spine, tilting the chin and lifting the head back is not something that I would recommend. What I can do is have another method which is called the jaw thrust. Now, to be able to do the jaw thrust, my thumbs will go onto the cheekbones, my fingers on the corner of the jaws, just below the ears, and I can thrust that jaw up, taking the tongue away from the back of the throat and keeping the head still. And again, you may hear that little gasp as the air goes through. Now the airway is managed and airway is open, I will be checking for breathing. I will check for breathing for 10 seconds. Okay, so lift the chin, tilt the head back, bring my head down nice and close, and I will check for 10 seconds. During that 10 seconds, I'm looking for 2 to 3 breaths. I'm looking for equal rise and fall of the chest. So if only one side is rising up and down, could be that they have a collapsed lung. When we assess, we look, we listen, and we feel. So I might be down there, I may feel the side of the breath at the side of my face there. I may see the rise and fall of the chest 2 to 3 times, but when it comes to listening, normal breathing is pretty quiet. So if I'm down there assessing and I can see the rise and fall and I can feel it but I don't hear it, it just means that they are breathing normally. Now, if it is a respiratory issue, you're looking at stridor breathing, so that high whistling sound, wheezing, think about asthma, bronchitis, maybe they've gone into anaphylaxis, maybe they've eaten something or something round about them that's caused that anaphylaxis, so tightening of the airways there may cause the wheezing. Gargling, so is there any fluid secretion at the back there, vomit at the back of the throat there, which is causing that gargling? Get the person onto their side or tilt the head and try and empty that out and then reassess the situation again. You could hear snoring, so maybe the tongue isn't off the back of the throat properly. It could be that there's a further swelling up in the upper airways, which is causing that snoring sound. Okay, so I'm down there for 10 seconds and I'm checking for breathing. I can't see no rise and fall of the chest, I can't feel anything, and I can't hear anything. They are not breathing. I will now start my chest compressions. Now, to do effective chest compressions, the heel of my hand will go into the centre of the chest here, okay? From here I automatically link my fingers, but that is okay and that is okay. From here, I'm going to bring myself up and over, so I'm using my body weight to do those chest compressions, and I'm looking to go down 1/3 of your casualty's chest. And I'm looking to do 2 per second, okay? So from here, I will give 30 chest compressions and then I will give 2 rescue breaths. 3, 4, 5, 6, 7, 8, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. Stop, and to give 2 rescue breaths, pinch the nostrils, lift the chin, tilt the head back. I will create a seal with my mouth around their mouth. I will blow gently, just enough to get that chest rising up. And then I will go back onto my chest compressions at a ratio of 30 to 2, 30 to 2, 30 to 2. Now, if you are unwilling to give breaths, maybe there's bodily fluids there such as vomit or blood and you're not willing to do that, or you don't have a face shield, you don't feel confident, don't do it. Continue with your chest compressions and you're looking to do 100 to 120 per minute. There are a couple of reasons why we could stop chest compressions. Maybe I'm exhausted, maybe I've been there for like 10, 15 minutes and I physically cannot continue chest compressions, then it's reasonable that I stop. Okay? Or maybe once the paramedics arrive on scene, they may take over the chest compressions. Okay? Or if they have a DNAR, which is do not attempt resuscitation. So if you realise or someone tells you and shows you evidence, so a document stating that they have a do not attempt resuscitation, then that is another reason why you would stop. So that's what we would do in the event of a medical emergency if we stumble across someone who is not breathing. So if you want to ask any further questions, any queries, any further in-depth explanations, please leave a comment down at the bottom and I will endeavour to answer each and everybody's comments. Take care.